this next section, we're going to talk about your wound treatment evaluation. I want to really discuss how your wound is being treated. Not what types of dressings you're using on it, but the wound itself. How are you treating the wound? Or don't you think you need any treatment? I'll give you an example. I had a patient that I was seeing, and every time I saw him, I needed to remove the callus from around the wound, and I needed to remove the edges from the wound. There's an effect called the edge effect, meaning every time you see a wound, you need to trim around the edges to get nice bleeding borders. If you don't have the nice bleeding borders, it's not going to heal in as well. If it's all calloused, it's not going to heal in. So every time I saw him, he came in with a wound almost covered. Covered, I tell you, it wasn't healed though. Okay, that's the key. It wasn't healed, it was just covered. And it was covered over the top. And every time I saw him, I had to trim that off with my surgical instrument, with my blade. I use a surgical blade to open it up and to cut the top of it. And every time he came in, he got mad at me and he said, "Well, you caused that." And I want to explain that I make it bigger, but it needs to be made bigger because you need to remove the edges and you need to remove the callus on top. So we're going to talk now about proper wound treatments and how you're doing it, how you're treating it. You need your wound treated. You can't just go around with an open wound. Someone needs to be treating it somehow. I'll explain why. Because when you have a wound, when you're walking on it, if it's not covered, or if it is covered, it tends to produce a lot of liquid, drainage. It tends to develop a type of a film on top of it, kind of like soap scum. And it also develops callusing around the edge. All these need to be treated. All these need to be removed. And there's many different types of ways of treating this wound. But I'll explain what needs to be done basically. When you have a callus around the edge of the wound, that callus needs to be trimmed off and it needs to develop nice red edges, bleeding edges. That's to help the wound to heal in and to get the healing components of your blood. This can't be done with a chemical on the callus. There's no other way to get the callus off. You can't just put a special medication and get the callus off, because most medications don't know the difference between calloused skin and good skin. The best way of doing it is with either something called a tissue nipper, a surgical blade, or some other type of a nipper or device to remove the callus from around the edge. In terms of the wound itself, when you look at the wound, there's different types of wounds. You have to look at the base of the wound. Is it granular or beefy red? Is it fibrotic or has like fibrous tissues? Or is it necrotic or black? Usually with these types of wounds, you treat them differently. The beefy red wounds, they tend to develop this film on the top of them. It's called a biofilm. That film needs to be scraped away and you have to have a nice bleeding border, a bleeding base to it. Once it's nice and bleeding, you know that you got all that film off. The film, that soap scum, just slows down the healing. That needs to be removed. It's all the drainage and all the liquid that's produced. Another way of treating it is by putting a vac or a vacuum on it, which is a piece of foam that sucks away all that drainage. It's very effective to help heal the wound, especially if it's a deep one. It's going to help to degranulate the tissue, form the tissue, so that then you can treat the top of the wound once that's off. The next type of a wound that's treated is a fibrotic wound. This fibrotic wound needs to be treated. You can try to remove all the fiber from it, but sometimes it can be difficult. So you may need to use a type of a gel or a medication in there as an enzymatic debrider. And I'll explain what an enzyme just breaks up two molecules. So the enzyme actually breaks up the fibrous tissue and removes it so that you can develop the nice beefy red tissue. The whole goal is to get the nice beefy red tissue. The fibrotic needs to transform into that. If not, it has a greater potential to get infected. It has a greater potential to not heal over the top. The black wound or the eschar wound typically can happen on the back of the heel if you have a pressure ulcer. These black areas, unless the wound is totally healed, you tend to leave them on there. You don't want to remove that black tissue because it's normally found in someone that has poor blood flow or high pressure to that area and keeps it stable. Unless it's falling off or unless it's very, very infected or draining, then that can be taken off. But there tends to be more of a fibrous type of base to it, and then you may want to use that other fibrotic medication to help get that fibrous tissue off. But the question is, when you're treating a wound, what happens if there's tendon present? If you can see the tendon, like this one. Or if you can see the bone, if it goes down to the bone. You can try to heal over the tendon and heal over the bone as long as it's not infected. You may need to do an X-ray or an MRI to determine the extent if there is any infection in the area. But bone certainly can be healed over as well as tendon as long as you have the proper techniques to heal it. Another area we want to look at, just to review again, is the skin edges. Are the skin edges calloused? If they're calloused, they need to be removed. That callus needs to be trimmed off. Are they macerated? Macerated means damp. We tend to talk about macerated between the toes, where it gets damp between the toes, but the wound edge as well can get damp. This is more common in a wound that drains a lot or in someone that is being treated with a vac, for some type of vacuum-assisted closure, because you pull the drainage off, and if it doesn't go all into the tube or into the foam, it can get around the skin and make the skin around the edge damp or macerated. Also, is there an area of high pressure there? If there's an area of high pressure, that pressure needs to be removed. Is there a bony prominence underneath it that needs to be removed or accommodated for with a special type of a shoe, a special type of a pad, or a special type of a boot that we're going to talk about in the offloading section. And then when you look at the wound as well, you want to determine not only if it goes down to bone, if it probes down to bone, but does it undermine or track anywhere? Undermining and tracking are two aspects of wounds. An undermined wound, for example, it may look this big, but when you put a cotton tip applicator, it goes even larger, meaning it's actually this big. It's much bigger. That area is usually calloused, and that callus tissue either needs to be removed or you have to pack the wound with something that can help it to kind of fill in. You don't want a wound just to cover. If the wound covers the top with a callus, it's not healed. It still is open on the inside, kind of like a cave. Very important to trim off the top and get that callus open, get that wound open so it can heal from the deep out to the skin. And there's a lot of different types of products and treatments that you can use for that. So if it's undermining, you need to remove that edge, remove that undermining aspect. Also, you have to see does it tunnel or does it track. A tunnel or tracking wound is typically found along a plane of a tendon. For example, on the top of your foot or on the bottom of your foot, there's different tendons that lift and go up and down the big toe. If you have a wound and then it finds its way into that tendon sheath, it can track all the way up the foot and cause an infection up there. And in that case, that area needs to be opened up surgically. When looking at wounds, those are non-infected wounds, but what happens if your wound develops an infection? How do you treat it? Can you only take an antibiotic? Or do you need to have some type of surgery to flush out the wound? Research shows that when you have an infection, when it's red, when your foot's hot, when it's swollen, when you have a fever, you may have an elevated blood count showing an infection. All these things are important, and it's an emergency for you. I want you to know that if your foot is red, hot, swollen, if you're looking at this, watching this, if it's infected, you need to be seen by a doctor because you need to have an antibiotic, but most importantly, you need to have the area opened up. Because if an area tunnels or goes deep and it gets infected, that area all needs to be opened up to help it to drain. The only way of draining an abscess, what an abscess is a deep infection. You have to drain the abscess. Because if not, the abscess will continue to destroy all the tissue around there. And it could even go down into the bone. So with an infection, it's very important for your skin evaluation, for your wound evaluation, to get the wound opened up. It's called an incision and drainage is the technical term. You open it, you flush it with a whole bunch of water or saline, and then you remove all the bad tissue. Any tissue that doesn't look normal, you need to remove. And then you have to get that wound healed. This is actually how I began my work with wound care with one of the doctors. We did many of these surgeries in the evening time for patients with diabetes. And they were slow to heal, and that's where I developed an interest in helping to heal foot wounds. Because if you have a wound that's open from surgery, it's going to take a long time to heal. But as well, other types of wounds heal the same way. Another aspect people always wonder are what other types of treatments are there for the wounds. You can use surgical, or regular steel, we call it, steel debridement, where you can take it and cut around the edge. You can use enzymes or different types of medications that you put in there that can help promote granular tissue. Or there's other types that can promote the fibrous tissue to return to normal tissue. Okay? Those are two different types. There's also some new research, or research has been done, about using sterile maggots, because maggots, what they tend to do is they eat away the bad tissue and they leave the good tissue. But more importantly, if there is an infection, that infection needs to be removed. There has been some research even, I know this is kind of out there, but if someone has an infected toe, for example, and they don't notice it, there has been instances where, for example, a household pet like a dog may remove the toe and the person doesn't know, but it saves their life because it's infected. So all these things are very serious, but ultimately your body needs to get rid of the infection. You have to remove it, either with your doctor or somehow it needs to be opened up and removed because it's very, very serious. Because it could be a limb-threatening, like your leg or your foot, or life-threatening if the infection isn't treated. And then cultures. Let's talk a little bit about cultures and when cultures are necessary. For your wound, if your wound is a nice, clean wound, cultures usually aren't done. But if the wound looks infected, then a culture is done. The best way of doing a culture isn't just to take a swab and swab the top of a wound. That's not going to get you clear culture results. You need to remove the tissue from the top and then try to get a deep culture from deep inside the wound where it doesn't have all the contamination from the top, from the air, from the type of the dressings, from everything else that's on top of it. It needs to go deep inside. So don't just take a swab. The best type of a culture actually is if you're concerned about, for example, a bone infection, is to take a little sample of the bone to see if the bone is infected, or to take a deep culture from deep inside of the wound to determine if it's infected. Now, very rarely, but it can happen, if you have a wound for a long period of time, if it's open, if it's not healing, you may have to look at, has that turned into a malignancy? Is there cancer in the skin? The longer the wound is open, the more prone to infection, and the more prone to either changing into cancer or it actually was cancer all along. So a biopsy is recommended if a wound has been open for over a year, over 6 months to a year. You can take a little biopsy, 2 little samples, send them off, determine if there's any changes in that ulcer. Because here's an example of a wound, but it actually is a cancer of the foot. These are very serious, and you have to determine what it is, if it's a wound, if it's infected, or if there's some type of transformation into a cancer. So in this section, we've looked at really the wound and how you should be treating it, how you should be treating the edges, how you should be treating the base of it, and how different types of products can be used to make it more beefy red, or how the different types of products can help it to heal in and produce more granular tissue. And then lastly, how it can get infected or have a cancer, and that should be treated with a biopsy or a culture to determine the infection.